Hi guys, for my discussion video, I am going to discuss Compton Scatter. Compton Scatter is important to know and be aware about because it can affect the patient, technologist, and the image itself. A little bit about Compton Scatter is Compton Scatter starts when an incident photon interacts with an outer shell electron of an atom. That outer shell electron will get knocked off of the outer shell and will become a Compton electron. That electron will go in one direction and a scatter photon will be created. That means that they will both go in a different pathway. And that's where we get our scattered radiation from. The patient is affected by scatter radiation or scattered photon because it can hit them where they're not getting imaged. So if you're doing a hand, that scatter radiation could go and hit their shoulder and just increase their radiation dose. That means we use shields to help protect some of the more sensitive areas, and so they might not get cell damage or tissue damage in those areas. The one goal of being a technologist is to reduce patient dose, and it is important that we are aware of Compton Scatter. Technologists sometimes forget that Compton Scattered exists. So that scatter photon, after we take the image, is floating in the air. So when we walk into the room, we can get affected by scatter radiation. So that means that our dose is also increased. I did not know, but Compton Scatter is the #1 cause of technologist dose because sometimes we have to rush if there's a difficult patient or if we have the IR in a position that is nerve-wracking, we run right back into the room, and that Compton Scatter is there. Another reason why we have to be aware of it is for image quality. Our images can be affected because scatter can create noise, and that noise can cause our images not to be as clear as they need to be a diagnostic image. So it's important to take our precautions. So a big issue is our field size when we're taking an x-ray. So that's why we collimate down, so it's only x-raying that particular area we need it to. Another good example is our KVP. If we use a lower KVP, that will decrease our scatter, and that means it will decrease the patient dose and the technologist dose, and it will possibly increase our contrast on our image. A big one is patient thickness or the part thickness. So if we are doing an abdomen, that is a thicker part of the body and more dense area. So that means scatter will increase normally in those areas. So if we could possibly compress someone's abdomen, it will decrease that it will decrease the scatter. A fun fact I found is Arthur Compton actually liked astronomy and wanted to look more into astronomy, but he started figuring out Comptons,